Today on our show, expectant mothers, don't you wish you could have your personal care provider in the delivery room with you? Well, here at the Delton Family Medical Center, that's not only possible, but it is normal. We've got a great team of panelists to talk more about that, including Carrie Kruger, who is the nurse supervisor for the Delton Family Medical Center. She has her associate's degree in nursing, started at Bluff in September of 2002 and has been a registered nurse for 8 years. Dr. Kimberly Saby, board certified family physician, has her BA in audiology from Reed College in Portland and went to medical school in Kansas City University and did a fellowship at the Swedish Medical Center in Spokane. Her start date is October 2005 at Bluff. She's been in her profession for 18 years. And Angie Olson, physician's assistant in family practice and OB here at the Delton Family Medical Center, started at Bluff in June 2009 and the Delton Family Medical Center in 2011. From the Delton Family Medical Center here in Lake Delton, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We are here at the Delton Family Medical Center, part of Bluff Health System, and we are here in Lake Delton talking about some of the services that are offered here at this clinic. And I'm joined by a fantastic team of panelists. We have Carrie Kruger, Dr. Kimberly Saby, and Angie Olson. Welcome.
Thank you.
Welcome back, I should say, because everybody here has been on at least once, I believe, before. So I'm going to just start out real quick with you, Carrie. Can you give us a quick overview of what types of services are offered here at the Delton Family Medical Center?
Sure. So here at Delton Family Medical Center, we offer a wide range of services. So family practice, our family practice providers are Dr. Saby and Angie Olson here. So when we talk about family practice, we talk about the spectrum of a patient's life. So from newborn care all the way up to geriatric, we can serve those patients and their medical needs. We have a specialist, Dr. Peck, that comes to our clinic for gynecology services, We also have audiology services. We have physical therapy that comes once a week. Diabetes education comes down and sees patients upon request. We have dietitian that comes down and sees patients. So we really try to bring services to our patients in this area.
It sounds like it, and it sounds like, I mean, you know, there's no difference in what you can get at this clinic as to what you could get at a clinic in a larger city too.
Correct.
So that's fantastic. Now, what I'd like to do is I'd like to have each of you give you an opportunity to talk about what exactly your role is here. So let's start with you, Dr. Saby. Give us a little bit of your background, your training, et cetera, and what is your role here at the Delton Family Medical Center?
So my background, I grew up in a rural area, but I grew up in Montana.
Okay.
And
very rural.
Very rural.
How close was your nearest neighbor? Like 700 miles or something?
Oh, no, it wasn't that far. And then, let's see, then I went to undergraduate in Oregon State.
Okay.
At a small school there, and then went to medical school in Missouri, and then moved all around the Midwest during residency. And then I did a fellowship out in Washington State for a year in obstetrics and high-risk OB. And then moved back here, and I've been here for about 11 years.
And you enjoy it here?
I love it here.
Excellent,
Yeah.
excellent. And Angie, how about you? A little background, training, et cetera? What your role is here?
So I'm a native to Wisconsin.
Okay.
Grew up near Fond du Lac, Wisconsin, in a small town, New Holstein. I have stayed in Wisconsin the whole time, so I went to got my undergraduate at UW-Madison and then continued PA school at UW-Madison, and I graduated in 2009.
Okay.
Out of PA school, I started working through Bluff up at the hospital doing urgent care for 2 years, and I've been here since 2011, so we've been a team for quite a while now.
And what exactly do you do here then at this clinic?
Yes, so I'm a physician assistant. I work with Dr. Saby to see patients for primary care, so we work pretty well as a team.
Very good, very good. And Carrie, back to you, same question.
Yeah, so I, as well as Angie, am a native to Wisconsin. I grew up in Elroy, so still live there actually with my husband and my children. So I started at Mile Bluff in 2002, graduated nursing school in 2009, did a year of med-surg, and then transitioned to OB, did 3 years of OB, and I've been here at the clinic now for 4 years. So my role here is the clinic nurse supervisor here. So I oversee the operations of the clinic on a day-to-day basis. So.
Very cool, very cool. Now, we have to take a short break in just a minute here, but when we come back, I want to make sure that we talk about prenatal care, postnatal care, and how much of that is available to patients right here at the Delton Family Medical Center. So we'll do that when we come back from break, right here on Wisconsin Doctors, so stick with us. Welcome back to Wisconsin Doctors. We are here at the Delton Family Medical Center, part of Mile Bluff. And the thing that really amazes me about this is the amount of services, the variety, the spectrum of services that are offered here right in this small clinic. And one of the things that I think we should talk about today is prenatal care, postnatal care, and that sort of thing. So I want to make sure that I cover all of this. So Angie, I'm going to jump in with you right away. Let's say that you have a couple who wants to get pregnant. And there are typically some things that you'll have the mother-to-be do before she gets pregnant. What are some of those things?
In general, it's just doing things that are already expected to help you stay healthy. So eating a healthy diet, getting regular exercise. Most importantly, to start a prenatal vitamin before you become pregnant. And then we also talk about things such as if they smoke, if they drink any alcohol, not doing those things if they're planning on getting pregnant.
Absolutely, very important, kind of common sense things. But you know, the prenatal vitamins, I understand, are the things that are really the thing that you want to start right away, even before you get pregnant.
Correct.
Yes.
Yeah.
So, Dr. Sabi, I think it's interesting to note that if a newly expectant mother sees you as their provider, there's a good chance that you actually might be delivering the baby when they come to term, which is pretty cool. So we'll talk about that in a little while, but I want to talk about this real quick. If a patient is newly pregnant, what is typically the first thing that they'll need to do, and then when should they be seen?
Well, as Angie was saying, we always, one of the first things we try to do even before they come to the office is talk to them on the phone to try to get an idea of how far into their pregnancy they might be. And during that conversation, which Carrie's often the one that speaks with the newly pregnant moms, one of the things that she will tell them is to start the prenatal vitamin if they haven't already. Right. In fact, we usually tell people if you're one of the phrases we hear a lot is people say, well, we're not trying to get pregnant, but we're not preventing it. So then we always just say, you know what, just take your prenatal. It's not going to hurt anything if you're not pregnant. Right. And we don't have a policy necessarily on how far along people have to be when they come in for their first visit. Some clinics don't want to see people till they're at least 15 weeks or 12 weeks pregnant. So when they're close to their second trimester is what that 12 to 15 week mark is. We feel like it's important to get to know patients right away, and oftentimes, especially with the first pregnancy, people have medications they need to discuss or healthy lifestyle things that we'd like to coach them on. And so when people are pregnant, we're always encourage them, just call us and we'll discuss what's going on, and we'll get you in right away if we need to.
I think that's really important because, as you said, getting to know the patient is really, really important, and getting to know like what their tendencies are and things like that. So
yes, I think that's really, and oftentimes it's just a matter, I think, of they have, especially with the first baby, they have real expectations for what their pregnancy care will be like and who is going to be talking to them. And then, also to keep in mind that oftentimes pregnancies don't go as planned, and sometimes when moms have a miscarriage, it's really helpful for us to have established a relationship instead of seeing them for the first visit when that happens.
Carrie, if a patient has any concerns that happen outside the regularly scheduled appointments that they would have, what can she do?
Call. I mean, that is primarily the number one thing that patients should be doing is call us. So we don't know if you have concerns. We don't know if there are things that you're concerned about physically, emotionally, you know, in an overall sense of the whole person. You know, if you think of mind, body, and soul, you know, we need to know if you have concerns, call us. Call us so we can talk with you. If it's something that I can't talk with you over the phone, absolutely, we'll get you in and we'll get you seen by the providers to see, you know, what we can do to help with those concerns.
Absolutely. We got to take a short break. When we come back, we're going to talk a little bit about the difference between traditional Western medicine approach to pregnancy and midwives. Don't go away. There's more Wisconsin doctors coming up after the break. And welcome back to Wisconsin Doctors. We are here at the Delton Family Medical Center in Lake Delton, part of Bluff. And Dr. Saby, I really want to talk about midwives for a minute.
Okay.
I mean, this is somewhat of an old concept. However, it's something that we seem to be hearing more and more about. And I guess, what is the difference between the care that a patient would receive from a midwife versus the type of care that they would receive under a primary care physician?
Well, I think that depends on where you deliver. At our hospital, all of the physicians in our group that do OB are, we have a very traditional family practice OB routine. So we all try to see our patients in the clinic as much as possible, and then we all try to be available for our patients when they deliver. So unlike a lot of other groups now where you get the on-call person after a certain time, if you go into labor, we're always available 24/7 for our patients.
That's very cool.
Yeah, it's good.
I think that's one of the things that makes this place unique is that, you know, you really do get a chance to, you know, be seen by the person that you've had that relationship with all along when it comes to delivery date. So.
Yes, yeah.
And speaking of getting closer to delivery date, Angie, I'm going to ask you this question. Babies are delivered at the Bluff Medical Center up in Mauston. So if a patient thinks they might be going into labor and they have been seeing you and Dr. Saby, where should they call?
Yeah, so if it's during clinic hours, they can always call us. So Carrie has a lot of experience in OB. She can typically triage those calls.
Okay.
Some of the things that we ask about is what kind of symptoms they're experiencing. So there's a lot of difference between true labor and Braxton Hicks contractions, which is false labor. And so we'll go through some of those things, see what kind of symptoms they're having. If the clinic's open, we can try to get them into the clinic to check them to see if their cervix is dilating, to see if they need to go to the hospital.
So you're able to do that here in clinic?
Yeah, we can do that here in clinic. And if the clinic is not open, then they should call up to Bluff Medical Center, and then they'll talk to the OB nurse.
And somebody's available at the hospital to take the call 24/7?
Correct, yes. There's someone there 24 hours a day to take that call at the hospital, and then if they are truly in labor, then they will be calling Dr. Saby.
Dr. Saby, one of the unique things about the Delton Family Medical Center is that obviously you typically be delivering the baby on delivery day. As we get closer to delivery day, let's say 36 weeks in, what sorts of things are you telling mothers around this time?
So when we see a patient for their first OB visit, we typically schedule all their OB appointments at that first visit. And one of the things that we routinely do is have patients start coming to the clinic for appointments each week from about 35 or 36 weeks through their due date. And the reason this is so important is because we're watching for symptoms of labor, but also for other things that might be abnormal during the end of the pregnancy that might be dangerous for mom and baby, like high blood pressure or preeclampsia.
Sure.
So we're always coaching them on symptoms, what to watch for, what to call for, and just having them knowing that they're coming once a week gives them a chance to ask more questions as the date gets closer, and we can come up with a plan together for their delivery.
Absolutely. And what exactly are the differences in delivery, such as, for example, spontaneous labor versus planned induction versus C-section?
So a spontaneous labor probably is the most, from a provider standpoint and from a patient standpoint is probably the most desirable, just because your body usually slowly goes into labor, so you have some time to adjust to the discomfort of labor. With an induction of labor, because we give medication to start contractions, oftentimes moms are much more uncomfortable because they go from no contractions to very intense contractions.
Yeah, it happens so quickly.
Yeah. And then C-sections, it depends on if it's a planned C-section or if it's an unplanned C-section. It can really affect the type of anesthesia or pain medicine that people are given. It can affect their recovery time, whether you've been in labor first or if you just show up in the morning for a planned C-section.
Absolutely. And we're going to talk about planned inductions right after the break here. We've got to take a short break, so Carrie, you're not off the hook just yet. We'll be right back here at the Delton Family Medical Center here on Wisconsin Doctors. Stick with us. Welcome back to Wisconsin Doctors. We are here at the Delton Family Medical Center, and I'd like to talk a little bit about postnatal care, but before we do that, we kind of left off at the end of the last segment talking a little bit about planned induction. So, Carrie, if planned induction is determined to be the best course of action, you'll be the one that sort of takes the time to educate the patient on what that all entails, right?
Correct, yeah. So if a patient signs up for childbirth education classes through the hospital, induction is one of the topics that they do talk about. However, if it's a patient that this isn't their first baby and they've had a baby before and choose not to go through the education classes, Dr. Sabi will oftentimes let me know, okay, I have this patient here, this is the date and time that I have them scheduled for induction, would you please give them a call and let them know, or take a few minutes in clinic with them at their next appointment to just talk about induction. And it's really important because induction is not something that a person typically thinks about when they are going through their pregnancy. They don't really say, okay, I know I'm going to have an induction at 39 weeks in pregnancy. So it is definitely something that needs to be educated on what the process is, because it isn't just like going into spontaneous labor. So.
And that's typically not something you would do either, is say, well, at 39 weeks we're going to induce you.
Correct.
You know, for somebody who's just newly pregnant.
Correct.
So
Yeah.
it's usually something where you want to try to see if the body can kind of take its natural course, and then if need be.
Yes,
so.
absolutely.
Okay, so the baby's here. Mom is happy, dad is happy. Well, mom is tired, dad is happy. Dr. Sabi, when do you typically want to see mom again?
So we usually have our new moms come bring their baby in the first week after they're born. So usually when they're about 5 to 7 days old.
Okay.
And it depends on what has happened during the labor and the delivery. We might have them come in sooner. Some moms who are real experienced and comfortable don't want to come in for 2 weeks. So that's one of the advantages of knowing our patients and knowing the families. We can sort of time that first visit based on what they need and what we want, what our concerns might be.
So is that a separate appointment then to see the baby and the mom, or do you see them together?
We try to get their appointments together, as you know, when the timing works out for them. Oftentimes moms don't need a visit for until about 6 weeks after they deliver, unless there's some concern that they have or that we have. But babies definitely need to be seen before that.
Sure. And you do see new babies at the clinic here as well?
Yes, absolutely. Yes, it is one of the highlights of our day, as well as many. But yes, those new babies are definitely welcome here. Dr. Sabi and Angie both see those new babies and are very experienced in the care that they provide for them. So
that's fantastic. Angie, what are some of the things you're looking for in these early stages of development in the infants that you see?
So that varies with each of their well child checks. So one of the nice things is that we work together throughout their pregnancy and afterwards. So typically we're seeing them, each of us are seeing them every other time during their pregnancy, and then again for their well child exams.
Okay.
So at each stage we're looking at their gross development, how they're moving, but we're also getting a hold on how they're talking and each of those things at their checkup. So probably the most important thing for those new babies is to get them on their tummy. Tummy time is so important.
Tummy time.
Yes, tummy time. You hear all about it, but really important
Yeah.
to get them on their tummies.
My kids hated tummy time. They both learned to roll over really fast because they hated it so much.
Didn't
They
like
wanted
it.
to see what was going on.
Yeah, well,
Dr. Saby, let's talk a little bit about recovery for mom. What are some things that you're looking for in terms of recovery in the days, weeks, and months following the delivery?
Well, we definitely talk with moms about their physical well-being, whether their bodies are kind of coming back to normal, how much bleeding they're having. But we also talk with them a lot about sleep and diet and fluid intake, and we also talk to them about their mental well-being. Mm-hmm. As we all know, having a baby can be really hard on your emotional state because you're tired and you have a lot of demands on you, and you don't get much time for yourself. And then there's also postpartum depression that we help to watch for. So when moms bring their babies in, even if mom doesn't have an appointment, if we get the sense that mom is struggling with making it through, especially those first few weeks, then we'll address that at the same appointment.
Absolutely. And Carrie, we just have about 30 seconds left, but why do you think the Delton Family Medical Center is a great place for mothers or expectant mothers to receive care?
Well, as you can see in this conversation, Dr. Saby and Angie are both equally invested in our patients through their overall health and wellness, but through the stages of pregnancy and post-delivery, newborn care, and beyond. So the experience, the relationships that we build with our patients, it definitely is something that we can say we work very hard to work with those patients and develop those good relationships. So
there you have it. Carrie Kruger, Dr. Kimberly Saby, and Angie Olson, thank you so much for joining us today.
Thank you.
And thank you for watching Wisconsin Doctors here at the Delton Family Medical Center. From all of us here at Wisconsin's 57, we invite you to live longer, live better. We'll see you next time.